Auzubillahiminash-shaytanir-rajeem. Bismillahir-Rahmanir-Rahim. I am Dr. Shahzad Wasim here again with another new video. Today we will be talking about a very important topic, and that is the effect of mobile phones on the eyes. Uh, Before wasting the time, I want to make this video small and give you as much information as possible. When younger population or people of any age watch the mobile for any reason, like they might be doing some positive activities, like they are studying on the mobile or they are playing games on the mobile. When the watch time increases, I have seen people around me, they start using mobile right from say uh, for 10, 12 and more than 12 hours continuously, and 4 or 6 hours is a norm to use the mobile continuously. Now what happens, mobile phone or gadgets like this does not directly affect your eyes or damage your eyes. First thing, these are safe things, but what happens, for example, if I carry my or spread my arm like this, I will not be able to hold my arm for more than 5 or maybe 10 minutes because my muscles will become fatigued, though I have not kept anything in my hand. The muscles of the eye, they are very sophisticated, they are very delicate, and when someone focuses on near objects, when we see far, our muscles are relaxed, and when we focus at near objects, our muscles become spasmed, like this one, just to let you understand. So just think, if a muscle is spasmed for 10 hours like this, what happens, the effects will be, when the patient will get off the mobile, he will see everything blurry, he will not be able to see clearly for the far vision for a couple of hours. But and if he routinely uses mobile phone and near work continuously like this, may be having this problem on permanent basis daily, and he will also have problem on seeing clearly for the near vision, though he does not have any eye problem or any refractive error, but the muscles are spasmed, they need to be relaxed. So what should be the routine? Whenever you see the mobile, or you must not use mobile more than 30 minutes at the most at one sitting. You must give some time, half an hour, take a walk, do some other work, try to see far, at the far things, not at the television, but some uh, good sceneries, or just move away so that your muscles become relaxed. Now these are the direct effects of the mobile phones, that is the spasm of the eye. Besides this, what happens, the user becomes so obsessed and so involved in the whatever he is doing on the mobile, that he forgets even to blink the eye. This causes the dryness of the eye. Nature has created our eyes with a thin layer of tears which are present normally in front of our cornea or the anterior part of the eye, which prevents our cornea and sclera from the foreign body and other infective things. By not blinking, what happens? The tears evaporate, and by evaporation of tears, the eye become dry. We have seen in clinical practice that dry eyes are also related to the aging, and usually they start normally dry eyes, element of dry eyes start happening after the age of 40 or 45 years. But these days I routinely see very young patients, even 15 years or 20 years, who come to me with severe dry eyes. There is no water, no tear film in front of their corneas, which causes other symptoms, that is pain in the eyes. They they cannot tolerate the light. They try to be in the dark rooms. Besides this, their neck muscles, they are also involved, and I have seen many patients with neck pains because these two muscles, which are called sternocleidomastoid, and the muscles behind our upper back and lower back, which is the longest muscle, is the trapezius muscle. I have seen the long-term effects of mobile use on these two muscles also, and the patient usually present with the neck pain and back pain, and ultimately pain in the whole of the body. They become lethargic, and there is an element of depression also, which is related to overuse of mobile in my observation, in my clinical practice. So my advice is to those who are watching this video to spread this message as much as possible, and to parents to keep an eye on the children, and even it is mobile or desktop or laptop or whatever it is, uh, let them use it wisely, as you know that excess of everything is bad, even if it is good. And directly uh, eyes are as such not damaged, which is a myth that mobile phone. People say that we have our children, or some patient says that I used to use the mobile so much so that now I have to use the glasses. This is not the case. The refractive error or the glasses, if someone has to wear, it is by default, if it is in his genetics, or if his other factors which are related to his wearing of the glasses. Mobile phone as such are not directly involved in the uh, need to use the glasses, but the factors and the symptoms and the signs which I've told you, don't take them lightly. They are very severe symptoms. The patient even becomes practically paralyzed, because he becomes housebound, room bound, inactive, and because of these things he may interact many other diseases like diabetes, or uh, he may gain the weight and things like that. But the effect on the eye is extraordinary. He will not be able to see the anything clear, even the faces of the people. If he watches television, it will be blurred. So the take home message is to use mobile wisely, not more than 30 minutes in one sitting. I hope this video is of some information, carry some information, and will be helpful for you. And if you feel so, please spread it for the benefit of the other people. Here I end my video. Hope to see you in my next video with some new topic, inshallah. Thank you very much. Allah Hafiz.